Dear colleagues, this is cataract surgery in a closed angle glaucoma patient. As you can see, it's a hyper mature cataract, fluffy cortex, and pressure inside the bag. I placed some trypan blue to stain the anterior capsule, and using the 25 gauge forceps, I'm able to fashion a round circle and large capsular axis. It's important in these closed angle glaucoma patients with fluffy iris and FS syndrome to have incision inside the cornea, clear cornea, not at the limbus, since this glaucoma patients with this type of iris are very easy to prolapse through the incisions. I'm performing a cross-section trench a little bit to make sure I have enough space for the sleeve to embed into the middle of the nucleus, and then using a long chopper I fashion a horizontal chop. It's very important in these closed angle glaucoma patients to keep the phacoemulsification at very efficient levels and have a quick surgery, not rushed surgery, but to be efficient in the anterior chamber and inside the bag to break the nucleus pretty easy and fast, and to have the maneuvers kept at the minimum so you can have a lower amount of inflammatory post-op, since the IOP can easily go up in the glaucoma patients with closed angle glaucoma in this case. The phacoemulsification, I'm trying to keep it inside the bag or at the iris plane in order to be away from the cornea. It's a very shallow anterior chamber, and as you can see, even though the incisions are in the clear cornea, with this fluffy iris is still getting inside the side port. The iris is getting inside the side port, but using the chopper I push that iris back and continue the phacoemulsification and ensure the phaco time it's one very efficient, and it's very important in these glaucoma patients to, especially in these closed angle glaucoma patients, to do a phaco procedure that's very fast in your hands to keep the trenching and all that at a minimum. So a divide and conquer or horizontal or stop and chop in this case, in glaucoma cases, will have a longer surgery time than direct chop or horizontal vertical chop. This piece of nucleus got stuck into the iris stroma. I took it off and inject the IOL inside the bag. Washing the viscoelastic from the anterior chamber is very important, since you have to avoid race in IOP post-op, pressing down the iris to break the anterior synechia, placing some myoclone in an air bubble, and injection of subconj agent of anti-inflammatory agent and antibiotic at the end. Thank you for your attention.